Welcome to the Prevention and Control of Infectious Diseases, including Immunizations training. As you go through this training, you will notice a green icon along with the word Resources in the upper right portion of your screen. Clicking the icon will open a window with information on the images used in this presentation. Clicking the Resources will allow you to learn more about the information used to create this training. In addition, some slides contain images, videos, or links that make this presentation more interactive. Clicking on these links will open information in new areas and will not impact the presentation view. This presentation also gives you the option to view subtitles, pause the slide, or replay the slide from the beginning. You may navigate to all the slides within the presentation using the sidebar on the left, but all slides within this presentation must be viewed in order for you to continue. This training provides trainees with information on prevention and control of infectious diseases in childcare, including immunizations. In partnership with the North Carolina Department of Health and Human Services, this training is being offered by the NC Child Care Health and Safety Resource Center, a program of the University of North Carolina at Chapel Hill, and is intended to meet applicable NC Child Care rules set forth under 10A NCAC 09.1102 Centers and .1703 FCCH. Those who satisfactorily complete the training will receive a certificate of completion for 1 contact hour. The university does not require this training. Completing this training does not qualify participants as certified medical or healthcare professionals, nor does it replace the need to consult a healthcare professional for guidance. Nothing in this training, including any and all contents, materials, or information provided as part of this training, is or should be considered or used as a substitute for medical advice, diagnosis, or treatment. Never disregard or avoid professional medical advice or delay in seeking it because of something you have read, heard, or seen as part of this training. Contact a child care health consultant for implementation guidance. Today's training will include information about infectious diseases, how they are spread, preventing these diseases, recognizing a child who is sick, and controlling the spread of infectious diseases. Infectious diseases are illnesses caused by specific germs, such as viruses, bacteria, fungi, and parasites. Some illnesses can be spread from one person to another, either directly or indirectly, and are called communicable diseases. Infectious diseases that commonly occur among children are often communicable and may spread very easily from person to person. Many illnesses are contagious before their signs and symptoms appear, and people can pass germs without having symptoms, or may continue passing the germs even after they recover from the illness. Illnesses may have incubation periods prior to symptoms first appearing. An incubation period is the span of time between first exposure to an illness and when the symptoms appear. For example, with varicella, commonly known as chickenpox, there is an incubation period of 10 to 21 days from your exposure to the time symptoms appear. Infectious diseases are spread or transmitted from one person to another in different ways, depending on the germ. This is called the chain of infection. You can stop the spread of infectious diseases by breaking any of the links in that chain. For the first link, the source of germs, or the sick child, you can correctly identify a child who is ill by a daily health check and observation. From this, you can determine if exclusion is appropriate and necessary. You can attack the root of transmission, the second link, by personal and general hygiene, healthy practices, proper sanitation, and environmental improvement. This means disinfecting toys and surfaces, completing daily health checks, using proper diapering techniques, hand washing, and ventilation. Finally, you can help protect other vulnerable children and adults, the third link, through immunization, good nutrition, and more healthy practices, like hand washing. Most common infections in child care settings are transmitted by direct or indirect contact. Skin infections, respiratory infections caused by a virus, and gastrointestinal tract infections are three of the most common types of infections you are likely to encounter in child care settings. Direct contact means the germ is spread through person-to-person contact, such as holding hands. Indirect contact means the germ is spread through contact with a contaminated object, like shared toys or a diaper-changing table or a caregiver's hands. Contaminated hands are the most common means of transmission of infection in child care settings. Transmission by droplets occurs when a person with an infection coughs, sneezes, or talks. Large droplets fly through the air a short distance, often less than 3 feet, and land on the eyes, in the nose, or on the mouth of nearby people. Finally, transmission of infection through blood or body fluids is rare in childcare, but can occur. Infectious diseases can impact anyone at any age. However, young children are at greater risk because their immune systems, the body's natural defenses against disease, are not fully developed. The following things help contribute to this higher risk. Children's behavior, which often means exploring the world with their mouth and hands. A child's small size compared to an adult, which makes the same amount of germs more hazardous. Their immunization status, particularly if they are not fully immunized, and their close contact with others. During outbreaks of vaccine-preventable diseases, children who are not fully immunized may be excluded by local health departments for varying lengths of time. Let's now take a moment to review some information covered in this section. Let's now turn our focus to prevention of infectious diseases in child care settings. First, let's discuss immunity. Immunity means that a person is protected against a disease by their body producing antibodies in response to the disease. People become immunized in two ways. One is by having the actual disease, which can protect that person from having that disease again. The other is from receiving vaccines, which contain dead, weakened, or components of the virus or bacteria. Childhood vaccines have been widely studied and are considered safe and effective. Vaccines prevent disease and protect both the individual and the community. If enough people in a community are immunized against a contagious disease, there is little opportunity for an outbreak of the disease. Some people are not fully immunized, such as infants, pregnant women, and people with an impaired immune system. These people are most at risk of contracting a disease from those who are not vaccinated. North Carolina law requires certain vaccines for all children present in the state. The North Carolina Immunization Branch recommends children receive all age-appropriate vaccines. Children must be up to date on required vaccines to attend childcare, unless the vaccine series is in progress because the child is on a catch-up schedule. This means they have started the vaccine series but have not finished because of the medically approved intervals between doses. North Carolina does not allow parents or guardians of children to refuse to vaccinate their children due to personal beliefs or philosophical reasons. The only allowable exemptions are for medical reasons or genuine religious beliefs. When a child is enrolled, their parents or guardians must submit the immunization record within 30 days of their first day of attendance. If the records are not received within 30 days, the child must be excluded. As children receive additional vaccines, their immunization records in their file must be updated and kept current. Current immunization records are needed to track which children are unprotected if there is a disease outbreak. During vaccine-preventable disease outbreaks, state and local health directors may exclude unimmunized children and staff from the child care setting. Early educators not current on their immunizations put themselves and the children they care for at risk. When family members and caregivers get immunized, they protect their own health and the health of the children they care for. Adult immunization creates a cocoon of disease protection around vulnerable people who aren't able to get immunizations, including babies during the first few months of life. Adults should receive all recommended adult immunizations. This includes annual flu vaccines and vaccines against pertussis, otherwise known as whooping cough. Adults should also receive the hepatitis B vaccine, if they may be in contact with blood. The Occupational Health and Safety Administration requires employers to offer the hepatitis vaccination series to employees who may contact blood or body fluids at no cost. In childcare, sanitation means cleaning and maintenance to prevent the spread of disease within the facility. Childcare centers must follow the sanitation rules from the Children's Environmental Health Branch. family child care homes must follow sanitation requirements outlined in the North Carolina Child Care Rules. Keeping objects and surfaces in a child care setting as clean as possible requires a combination of frequent cleaning and an application of a sanitizer or disinfectant. The terms cleaning, sanitizing, and disinfecting are sometimes used interchangeably, but they each mean something specific in child care. You should always clean with soap and water before sanitizing or disinfecting. Sanitizer sprays are generally used for food service areas and toys or surfaces that have been mouthed. Disinfectant sprays are generally used for areas that may be contaminated by diapering or toileting germs. Remember that washing your hands is the most important way to reduce the spread of infection. Many studies have shown that improperly washed hands are the primary carriers of infections. Poor hand hygiene has contributed to many outbreaks of diarrhea among children and caregivers in child care programs. Your first step in proper hand washing is to wet your hands. Make sure to have liquid soap and clean disposable or single-use towels accessible. Use warm running water between 80 and 100 degrees Fahrenheit to wet hands. Next, you need to apply liquid soap. After applying the soap, rub your hands together until lather appears. Wash the front and back of your hands, wrists, nail beds, between fingers, and under fingernails and jewelry. Continue for 20 seconds. After washing your hands, rinse your hands with your fingers pointing downward under warm running water. Then dry your hands using a clean disposable or single-use towel or a mechanical dryer. Continue until your hands are completely dry. Finally, turn off the water with the towel and dispose of the towel in a hands-free, plastic-lined receptacle. You've learned the importance of hand washing. Now let's talk about when you should wash hands during the day. As a rule, you should wash your hands upon arrival for the day, after breaks, when moving from one child care group to another, or any time your hands are visibly dirty. Also, hands should be washed before leaving the center to go home. You should wash your hands before and after, preparing food or beverages, eating, handling food or feeding a child, giving medication or applying a medical ointment or cream in which a break in the skin may be encountered, caring for an ill or injured child, playing in water that is used by more than one person, playing with sensory materials such as clay or Play-Doh, or diapering. Additionally, you should wash hands after using the toilet or helping a child use a toilet, handling body fluids, handling animals or cleaning up animal waste, playing in sand, on wooden playsets, and outdoors, cleaning, handling soiled items, applying sunscreen or insect repellent, and when removing gloves. The way you are required to wash your hands in childcare may be different from what you do at home. Wash your hands in the specific way shown on this poster to avoid getting sick and spreading germs to others. This poster and the following posters can be ordered free of charge from the North Carolina Child Care Health and Safety Resource Center. The child hand washing procedure is the same as the adult procedure. When encouraging hand washing, make it fun with songs and activities. The ABC song, for example, lasts 20 seconds, which is the recommended length to suds hands. Try to find other songs that last 20 seconds. Let's now look at each of these steps more in depth. Infants and young toddlers and children with physical disabilities, developmental delays, or injuries which prevent them from standing at or rolling to the sink also need to have their hands washed. If an adult can safely hold the child at the sink, the child should have their hands washed at the sink. If an adult cannot safely hold the child at the sink, use the 3-towel method described on the Assisting Children with Hand Washing poster. 1. Wipe the child's hands with a damp paper towel moistened with a drop of liquid soap. 2. Wipe the child's hands with a second wet paper towel. 3. Dry the child's hands with a third paper towel. Proper diapering is another key part of child care sanitation procedures. During diaper changes and toileting, areas such as hands, floors, faucets, and toilet handles, diaper changing areas, toys, and countertops are easily contaminated by feces, which may carry germs. These germs can cause diseases to spread throughout the classroom. The procedure for diaper changing is designed to reduce the spread of germs from one person's feces to someone else. For children toilet training, the stand-up changing poster can guide staff in correct procedures for assisting children. Unfortunately, from time to time, children get bumps and bruises, and providing first aid in situations where blood is present is part of the early educator's job. Split lips, scraped knees, and other minor injuries associated with bleeding are common in childcare. Anyone designated to provide first aid or medical assistance as part of their job duties is covered by the Occupational Health and Safety Administration Bloodborne Pathogens Standard. This standard requires employers to have a written exposure control plan in case of contact with blood or other potentially infectious materials, and to provide training for their employees on the program's exposure control plan, how HIV, hepatitis B, and other blood-borne diseases are spread, how to use standard precautions, and reporting procedures along with any other program-specific policies. Using standard precautions in early care and education settings can reduce the spread of blood-borne pathogens. Standard precautions include wearing gloves at certain times, such as when you're in contact with blood or other body fluids which contain visible blood. You should also wear gloves when you have open wounds or sores on your hands to avoid contact with germs. Wearing gloves during diapering are recommended but not required by rule. Be aware that gloves are not required for feeding human milk or cleaning up of spills of human milk. Proper disposal of materials soaked in or caked with blood requires placing the object into one bag, placing that bag into another, and making sure they are securely tied. Send these items home with the child, or if you wash them separately from other items. A special container is needed for safe disposal of items used for procedures on children with special needs, such as lancets for finger sticks, or syringes for injections brought in by parents. Parents can provide what is called a sharps container. This container safely stores needles until the parent can take them home for disposal. Finally, let's focus on the management of infectious diseases in a child care setting. One step you can take to prevent the spread of infectious diseases is recognizing a child who is ill through a daily health check. It is a way for early educators to check for a change in a child's health and well-being. A daily health check helps early educators establish what is normal for each child. You should conduct a health check as soon as each child arrives at the facility and whenever a change in the child's behavior or appearance is noticed. The sooner sick children are identified, the sooner their health needs can be addressed. Early identification can also reduce the spread of disease. Health checks cover any known illness or injury affecting the child or other family members, changes in behavior or appearance of the child, skin problems, temperature checks if the child appears ill, and other signs or symptoms of illness or injury. To complete the health check, you should start by getting on the child's level. Then, look for signs and symptoms of illness. Listen for complaints and unusual sounds from the child that might indicate they are not feeling well. Also, listen to what a parent shares about the child or other illness in the family. Feel for a change in the skin that might indicate a fever or dehydration. And smell for unusual odors that might indicate an underlying disease. It is useful to have a copy of the Signs and Symptoms chart found in Appendix A of the Caring for Our Children resources, available to all child care facilities as a reference guide. It lists common conditions like cough, diarrhea, and rashes, along with their common causes and steps to take if a child has any of these signs and symptoms. The Communicable Diseases and Exclusion Chart aligns with the North Carolina Child Care Rules. Use this chart to learn about diseases, their symptoms, how to prevent them, and when children must be excluded from child care. The North Carolina Child Care Health and Safety Resource Center's website contains a fully searchable chart on communicable diseases and exclusion that you may use as a reference. The Communicable Diseases and Exclusion Chart explains when a child must be excluded from childcare. You should exclude a child if you are directed to do so in the chart, or if the child's physician recommends exclusion, the child is unable to participate in activities as normal, or the child cannot be cared for without compromising care for other children in the group. Some of the exclusion criteria is clear, such as a child who has a certain infectious disease or other measurable criteria. For example, the North Carolina Child Care Rules require exclusion if an infant under 2 months of age has a fever of 100.4 degrees or higher. If a child over 2 months of age has a fever of 101 degrees or higher, they must also be excluded. It does not matter which method is used for taking the temperature, whether in the mouth, under the armpit, or another method. The exclusion criteria is the same for all methods of taking temperatures. The rules also require exclusion for 2 or more episodes of vomiting within a 12-hour period, more than 2 stools above the child's normal pattern, and if diarrhea is not contained in a diaper. Child care centers are required by NC sanitation rules to have written procedures in place for employees to follow in case there are episodes of vomiting or diarrhea that occur in the center. These procedures must address steps staff will take to minimize the spread of germs and the exposure of staff, children, food, and surfaces to vomitous or fecal matter. More information on plans can be found on the Children's Environmental Health Training page. Other exclusion criteria will involve a judgment call that you must make. For example, a change in a child's typical behavior will be different for each child. Make sure your center has a written exclusion policy that is implemented consistently and reviewed annually. Upon enrollment, families should be aware of this policy, including the criteria for exclusion and readmission. If policy changes are necessary, parents should be alerted to these changes at least 14 days prior to implementation. In the early care and education settings, where people from different families spend many hours together in close physical contact, germs are spread more easily. By following the precautions for preventing and controlling infectious diseases, you reduce the risk in your community as a whole. Thank you for your time and attention in this training. Continue on to complete the training and earn your certificate.